It does feel like we're perpetually bombarded by conflicting messages from experts on how to live healthier lives, how much alcohol we can drink, how much coffee, which are the superfoods, which are the killers, and the like. One message that's been consistently hammered home has been the causal link between sunshine and skin cancer. Might we, however, now be covering up too much as a consequence, with the suggestion that as many as 25% of people, a quarter of people in the UK, are deficient in vitamin D. Joining us now, the nutritionist Dr. Carrie Ruxton, who's in Dundee, and Jessica Harris from Cancer Research UK, who's in our central London studio. A very good morning to both of you, and thanks for joining us. Dr. Ruxton, let's begin with you. I think you define vitamin D deficiency as the level below which we can't sustain normal bone health. Now, people will be familiar with what happens when you don't get enough sunlight. They'll think of things like rickets. But you're actually saying there are other problems that can beset people if they don't get enough sunshine.
Yes, that's absolutely right. We've got 25% of the UK population who are deficient from a bone health point of view in spring of the year, and that's because we don't make any vitamin D during the winter. But there's now increasing evidence that vitamin D is important for heart health, for immune function, perhaps for cancer and even multiple sclerosis. And we probably need much higher levels of vitamin D in our blood to ward off these conditions, but the experts are not yet sure what that level is.
And you make the point, don't you, Doctor, that it's getting the right kind of sunshine that matters, if I can put it that pejoratively?
Yes, that's right. We only make vitamin D in the summer months of the year. So for 6 months of the year, we have the right UV light to make vitamin D, and in the winter we don't. So what that means for the average person is we need to get outside for about 15-20 minutes every day during the summer months, and some of that is without sun cream, I would have to say. But then all year round, we need to increase our dietary sources of vitamin D to top ourselves up, and that would include oily fish, vitamin D supplements and fortified foods like yogurts, and for children things like milks as well, and breakfast cereals are important.
Jessica Harris, this is one of those difficult ones for public health officials, isn't it? Calibrating the message. I mean, quite clearly we all have worries about skin cancer. There are clear and defined linkages with too much sunshine and skin cancer. It's getting the dosage right that's the trick, isn't it?
Well, it's just important to get a good balance between, on the one hand, making enough vitamin D, and on the other hand, not raising the risk of skin cancer. And we know for sure that getting too much sun, getting sunburn is a clear sign that your skin has been damaged. That damage can go on over time, build up and lead to skin cancer. But it is important also to get enough vitamin D, and it should be possible for most people to achieve a good balance between enough vitamin D on the one hand and not raising the risk of skin cancer on the other hand, by just enjoying the sun safely, taking care not to get sunburnt, and because sunburn is a really clear sign, as I mentioned, that the damage is being done.
Yeah, Jessica, just help us with what you consider to be a safe amount of sunshine, or does it vary from person to person?
Well, it's completely impossible, unfortunately, to give a one-size-fits-all recommendation about how much sun you need to make enough vitamin D. The reason for that is because everybody's skin is completely different. Everybody's skin will make vitamin D at different speeds. People will be more or less at risk of sunburn, depending on their skin type. And also because the amount of vitamin D you make varies enormously, dependent on the weather, how strong the sun is on that day. And there are so many factors that play into it that the only really useful rule of thumb, I would say, is that if people are taking care not to get sunburnt, they can be relatively confident that they're not raising the risk of skin cancer and doing as much as they can to make enough vitamin D.
Dr. Ruxton, we've all been at the beach, we've all been on the seashore, and we've seen those kids wading into the surf wearing what looks like those Victorian bathing suits, covered head to foot in sun cream. Have we gone overboard?
I think we have actually, but the Scottish Government's actually got a very sensible approach. They say you only need 10 or 15 minutes a day in summer to make enough vitamin D. So let the children out for 10 minutes without a hat or sun cream, and then take the usual precautions. So it is, as Jessica said, very important to guard against sunburn, but all we need is this 10-15 minute window during the day in summer to make enough vitamin D.
OK. Dr. Carrie Ruxton, Jessica Harris, thanks both very much indeed.